Okay friends, with the prior knowledge of the radius, we hold the bone in anatomical position. This bone belongs to my right hand. Look at the concave part. Look at the styloid process which is laterally placed. We look at the interosseous border which is medially placed, upper end and lower end. We talk about the attachment on this bone. Okay, we are talking about the attachment of this bone. This is the head and this is the concave part of the head which is articulating with the humerus, capitulum part of the humerus. Not only that, this is also articulating with the ulnar bone, and there is the notch. This is ulnar bone. This is attached with this one with the help of annular ligament, and we talk about the pulled elbow like condition in the children. Okay, now we will talk about the attachment. This is the anterior oblique line which is continuous anterior border and end into the anterior part of the styloid process. Okay, between the interosseous border and this anterior border there is an anterior surface. Upper 3/4 part of this interosseous border, upper 3/4 part of this interosseous border having origin of a muscle which is going toward the thumb, because bone is toward the thumb. This bone belongs toward the thumb, and because this is arising from anterior surface, definitely this is a muscle of the deep compartment, the flexor of the forearm. So this muscle is flexor. This muscle belongs to the pollicis, and because coming from outside the wrist is longus. If it is coming from the wrist, that is brevis. But this is flexor pollicis longus. Simple. Toward the thumb, pollicis. Because the flexor pollicis outside the palm and inserted into the thumb, flexor pollicis longus. That means flexor pollicis brevis is also there. Okay. Now from the lower part, look at this one. At the lower part of the bone, there is insertion of another deep muscle of the flexor compartment of forearm, and these are the fibers of pronator quadratus. If my fingers, two fingers, are presenting the fiber of pronator quadratus which is arising from the ulnar bone, these are inserted like this: superficial fibers and deep fiber. Look at this. This finger indicates the superficial fibers and this finger indicates the deep fiber. The deep fibers are attached in this triangular part which is made by the bifurcation of interosseous border, and superficial part in the lower fourth of the anterior surface of the radial bone. A ridge is also there. Here the ridge is also there. This is attached with the forming the radiocarpal ligament and wrist ligament forming. Okay. This is the anterior surface. Flexor pollicis longus in upper 3/4 part, lower 1/4 part there is the insertion of the pronator quadratus, that is anterior surface. Now coming toward the posterior surface, in the middle 1/3, again the posterior oblique line is there. I am not talking about the posterior oblique line. This middle 1/3, the first muscle, the posterior surface in between the interosseous membrane and the posterior border. Middle 1/3, this give origin to the muscle which again belongs to the thumb but posteriorly this time, forming the anterior boundary of the snuff box, that is abductor pollicis, and coming from the outside, longus, abductor pollicis longus. Another muscle very near to this one, lower 1/3 part. This is a smaller muscle comparatively. So, and this is again forming the snuff box, anterior boundary of snuff box, extensor pollicis brevis. Three muscles, whether anterior surface or posterior surface, belongs to the thumb. These are the abductor pollicis longus, extensor pollicis brevis in a common sheath, also forming the anterior boundary of the snuff box. Okay, these belongs to the posterior surface. Okay, now coming toward the lateral attachment. A muscle moving like S-shaped form like this, come on, ulna and holding like this, attach in the upper part of the lateral surface, rounded area. This muscle again is divided, like giving a gap, like gap between my finger and one nerve is passing in between them. That's your question. What nerve is passing between the two heads? But this is known as supinator. This muscle is also forming the floor of the cubital fossa. This is attached somewhere here. And the neck, wind round the neck and attach on the lateral part of the neck, upper lateral part of the neck, and this muscle is known as supinator. When coming to this lateral surface, which is lying between the anterior border and the posterior border, this lateral surface having a most convex most part, which is having a rough ridge, there is an insertion of a muscle that is known as pronator teres. Okay, pronator teres like coming like this, and again this attached here. Most convex part of the lateral surface, pronator teres. Okay, now very important thing, look at this. This is the anterior oblique line. This is the anterior oblique line, and articulating like this. This is capitulum. This is articulating here. A muscle which is attached from the medial epicondyle like this, like my finger, and running along with this anterior oblique line, attach anterior oblique line and running into digits. Okay, in an arch-like way, this is arise from the medial epicondyle. Then is having attachment with the anterior oblique line and the running downward and divides into digit. That is known as flexor digitorum superficialis is attached. So anterior oblique line also giving attachment to the flexor digitorum superficialis. Once again, I want to revise anterior surface, the flexor pollicis longus, pronator quadratus. The posterior surface, abductor pollicis longus, extensor pollicis brevis. The lateral surface, upper part, supinator, and the most convex part, the pronator teres. Okay, an anterior oblique line having attachment to the flexor digitorum superficialis. Not only that, never ever forget the attachment of the tendon of the bicep brachii, which is attached on the posterior aspect of the radial tuberosity, anterior aspect having the relation with the bursa. Okay, now coming toward the lowest part, which is having anterior surface, the medial surface, the lower surface, the lateral surface, and the posterior surface. The posterior surface having a dorsal tubercle of Lister and lateral to this tubercle of Lister, that is toward the styloid process. There are two muscle, extensor radialis longus and extensor radialis brevis, both running in a single groove. Medial to this dorsal tubercle of Lister, more medially, okay, this is lateral side. Now more medially to dorsal Lister tubercle, there are extensor digitorum and extensor indicis is lying there. Okay, so this is the dorsal surface. A styloid process, up to the styloid process there is attachment of the brachioradialis. Okay, brachioradialis, which is arising from the lateral supracondylar ridge, brachioradialis. Okay, the lowest part is articulating with the same side, scaphoid and trapezoid. The scaphoid and lunate are articulating with the lowest part. Look at this one. For the scaphoid, this is scaphoid and lunate are articulating the lowest part. Most of the carpal bone actually coming within the groove or the ligamentous groove of this bone. Okay, so these are properly articulating this one, and so this is the lowest surface. So we talk about the anterior surface, we talk about the medial surface. The medial surface having a triangular part, having insertion of the D fiber of pronator quadratus, and this is having attachment with the ulna, lowest part, carpal bones, a styloid process having brachioradialis. These are attachment on the lowest part. Now a very important clinical aspect. A female of 40 years which is supposed to be osteoporotic is fall on the outstretched hand and weight is transferred on the wrist. Maybe scaphoid, maybe fracture. But if weight is transferred properly, there may be fracture of the lower part of this radius, and this part, the fragmented area goes posteriorly. Suppose I'm keeping my fingers like this fragmented area. This goes posteriorly and dorsally replaced. This is known as Policis fracture. This is known as Policis fracture, which is more common in 40-year females because they are supposed to be osteoporotic when they fall outstretched handedly. Okay, you have to examine the snuff box also for the scaphoid fracture, but that is also important. Colles fracture. Reverse of the Colles fracture, when the fragment is anteriorly displaced. Suppose this is my finger, anteriorly displaced, ventrally or anteriorly displaced, the Smith fracture. Okay, one fracture where this fragment is broken and displaced dorsally and posteriorly, that is known as Colles fracture. Reverse of this Colles fracture, where the distal fragment which is broken is anteriorly or superiorly or anteriorly ventrally displaced, that is known as Smith fracture. Okay, sometime only the stylet process is fractured, that is known as Schoeffer's fracture. Schoeffer's fracture. Three fractures. Basically, I am discussing three fracture when the lowest part distal segment is broken and dorsally and upward displaced, that is known as Colles fracture. When it's ventrally anteriorly displaced, that is known as Smith fracture. If the stylet process fractured, that is known as Schoeffer's fracture. Not only that, this is not uncommon fracture of the head of the radius, and in many cases head of the radius, if get fractured, it may be fragmented in many pieces. Then you have to excise the head of the radius. The radius bone is very important to learn about the attachment of the flexor or extensor compartment, as well as it is clinically very important, because on the transferring weight on the palm, if the person is falling in osteoporosis, may be fracture of the scaphoid which is underlying this one, and if the weight is more transferred to other radius, there may be Colles or Smith fracture is there. You have to search in the lower part of the radius for the same. Not only that, friction or pain in the bursa may be there, and that may be felt in the cubital fossa. Due to these reasons, you have to read the radius bone carefully. This is one of the bone which is frequently asked by the examiner, and this question, radial tuberosity, is one of the most important and most frequently asked question in the radius bone. Hoping happy learning. Thank you.